7. The current guidelines and opioid prescriptions limit access to effective treatments for people with severe chronic pain conditions and fail to consider individual patient needs and circumstances. This one-size-fits-all approach leaves many patients undertreated and unnecessarily suffering. Most people who take opioid medications are already disabled. Those that are still working may need them to continue to work to provide for their family. Sometimes that's their only choice. Many of us need pain medication to function in our daily lives. Many of us must have something to even get out of bed because the pain is so horrific. Chronic pain patients have flares, which should be considered and treated as acute pain. Chronic pain in and of itself is a disease of its own, merely due to the nature of our nervous system. Once you have chronic pain, it doesn't get better, it just worsens. Patients are forced to ask themselves, what do I do when I am in pain? Do I pick up Tylenol or ibuprofen or Aleve? Now imagine that you've done that for 10 years and it seems to not be helpful anymore and causes undesirable effects that can be permanent. Imagine reaching out for help and having your hand slapped away because someone else had a bad experience requesting the same exact help. Imagine going to the emergency room after waiting around to make sure you aren't overreacting and calling your doctor trying to avoid going, all to just get there and be treated as if you're a criminal. Imagine going to the emergency room with stroke-like symptoms due to a severely complex migraine, which opioids don't even treat, and only getting opioid counseling. You were there to ensure you didn't have a stroke. You've been forced to wait 4 hours because someone doesn't believe you. Imagine that patient doesn't live because some doctor chose not to believe them at all. It has been a very long time since I've experienced going to the hospital and leaving with any type of prescription, let alone pain meds. It's so bad for us, they won't even give us fluids. We are forced to choose the worst afflicted body part when a lot of the time, the problem is systemic. Imagine being in the ER for a bad accident and they only want to offer you gabapentin, which takes weeks to get into your system in the first place. You just want your pain treated appropriately. Welcome to the reality of the chronic pain patient. Nobody should be left to suffer needlessly.